Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started.
Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. I am your host, Erika Mayall. I am so glad you are here with me today. This is the first episode of 2025, and I am super excited to be starting another year of the Dance Physio Podcast. I recently, I can't remember when, it was maybe a week or so ago, posted on my Instagram stories just asking if people had any suggestions or requests for podcast topics. And that invitation is always open. If there is ever a topic that you're like, oh, I'm really interested in learning about XYZ, please feel free to send me a message. You can send me a DM, you can send me an email, whatever. I am always open for topic requests. But I put up a story and quite a few people who responded were requesting topics around anatomy, and specifically anatomy for dancers, obviously. And it made me realize that this isn't a topic that I've really covered much at all on the podcast. And part of that, I think, is because with it being an audio medium, I feel like anatomy is sort of a bit hard to cover sometimes, in the sense that to me, anatomy is such a visual thing. And with an audio format, sometimes I feel like maybe it's not the best way to go across or to get across teaching concepts when it relates to anatomy. But enough people requested it, and I've been having some other conversations with people in clinic, and it's been coming up a lot recently. So I decided that today, for this first podcast of 2025, we are going to try and tackle the topic of, I'm calling it Dance Anatomy 101. So a very high-level overview of anatomy. So I'm not going to get into a lot of like specific nitty-gritty details today. However, we'll see how this podcast episode goes, and if it is a topic that you're interested in me trying to dive deeper into more specific anatomy topics in the future, let me know. Let me know how it works as an audio format for you. Like I said, I don't know that it's like the best way to teach anatomy, but everybody obviously learns differently. So if people are finding it really helpful, I am happy to do more podcasts about anatomy topics. I absolutely love anatomy. It's one of my favorite things to talk about. So I am happy to do that. So we'll see how today goes. And like I said, let me know, send me a message, and we can always deep dive into some more specific anatomical stuff in the future. But today, like I said, we're going to do a higher level overview. I want to talk about why I think anatomy is such an important topic for dance educators and for dancers to learn about. And then, like I said, I'm going to get into some just overview stuff of anatomy, just so we have a basic understanding of some dance anatomy concepts. So I truly think anatomy is one of the single most important things that dance teachers specifically should know about. And I often get a question from dance teachers being like, oh, what should I be doing for continuing education? What courses do you recommend? Or you see it in Facebook groups and people looking for the latest technique course or syllabus type course or anything to kind of like enhance their teaching. And I am always going to be the person who suggests like deep dive into anatomy, because I truly think the more we can understand the human body and how the human body moves and how our body is built and things like that, it really enhances a dance teacher's teaching. Like, I don't think that it is very easy to teach complex technical skills if you don't understand the anatomy of what's going on. And it's super difficult to problem solve with dancers who are maybe struggling with whether it is a step or just a technique thing in general if you do not understand the anatomy. And so really understanding anatomy at like a deeper level than maybe what a lot of dance teachers maybe understand it at, I think is really beneficial. I don't know all of the teacher training programs available to teachers out there, but a lot of the ones that I am familiar with, I personally don't think they always cover anatomy in as much depth as they probably could or should. I know there are a lot of dance teachers who have a degree in dance, like maybe they did a BFA or something before they went into teaching. And oftentimes anatomy is a component of a university dance program. And so those teachers maybe have been exposed to a bit more. But teachers who have gone into teaching and have come from a more just going through a teacher certification process through maybe one of the like syllabus governing bodies or things like that, depending on what program you went through, you may or may not have been exposed to a lot of anatomy teaching. And if that was something that maybe wasn't a huge part of your program, then I do feel like teachers really benefit from understanding anatomy on a bit of a deeper level. I also think that the better your understanding of anatomy is, the better able you are to explain it to students. And that's not necessarily saying that you're going to be using super in-depth anatomical terms, but if you're trying to explain the technique behind a step or explain what is happening in the body, you need to understand that yourself. And I know that when I take classes, depending on where I'm taking class and which teachers I'm taking classes with, sometimes the explanations that they are giving are not actually anatomically correct. And I think that can cause a lot of confusion for dancers because dancers can't always feel what is meant to be happening in their body if the wrong language or the wrong anatomical references are being used. So I truly do think that understanding human anatomy is one of the single most important teaching skills that a teacher can have. I also think it's really, really important for dancers to be exposed to anatomy. And a question I get from teachers often is like, oh, at what age should we be introducing anatomy like to our classes? And I honestly think it can be introduced right from the very beginning. Obviously, you're going to be teaching it at different levels in terms of if you're teaching a preschool class versus teaching, high school students or that type of thing. But I am a big believer that we should always be using as much anatomically correct terminology as we can, as is age appropriate. And so, I always tell the students that I work with, I never expect them to know the name of every single muscle and every single joint and every single bone in the body and things like that. But I do expect them to have a pretty basic understanding of the major ones and some like kind of overall or overarching concepts. And I think the younger we can introduce this to dancers, the better off they are. It's really important for dancers to understand anatomy, to be able to understand how their body is moving and how their body operates. And whether they go on to continue dancing in the future or whether it's just something they do when they're younger, it is a really important life lesson or a life skill as well. The number of adults that we get coming into the clinic who really have no concept of how the body operates. Like we don't get an operating manual, but when we teach them some of the, anatomy or some of these concepts as part of a physiotherapy treatment session, it makes so much more sense to them. They have so much more ownership and autonomy over their body when they understand a little bit about how it's operating or how it's working. So the more we can empower dancers with that knowledge at a younger age, the more they will understand how their body operates and how their body moves or is meant to move. There's also been some research that's looked at introducing anatomy to dancers in terms of injury prevention and in terms of injury recovery and healing. And there is some evidence, I'm not going to say it's strong evidence necessarily, but a trend towards dancers who understand more anatomy are less likely to get injured, or if they do get injured, that they are potentially going to recover faster or in a safer manner if they're understanding, again, what is happening. And this makes sense. It's maybe hard to kind of prove with a study, but it makes sense if we understand how our body operates. We're probably less likely to do things that are potentially going to injure or damage our body. And so that's probably where the injury prevention side of things comes in. And then again, if we do happen to have an injury, we're going to understand and probably follow and stick to a rehabilitation plan better if we understand a little bit about how the body operates. You're more likely to kind of buy into that plan and follow through with it. So I think there's a lot of different reasons why it's important for both dance teachers and dancers to have a fairly basic understanding of anatomy. And for teachers, I truly think that they should have more than a basic understanding. I think teachers really should probably have more anatomy than, I'm going to say, the average teacher has. I know there are teachers who have a lot of anatomy knowledge, but I do know there's a lot of teachers that's maybe not where a lot of their kind of training, the area that a lot of their training was in. So that's all I'm going to say about why I think it's really important for dancers to learn about anatomy and to understand anatomy. I'm going to get into sort of, like I said, we're going to call it Anatomy 101. It's a very general overview of anatomy, but hopefully this will help some of you just to understand things a little bit more. So in terms of general organization of anatomy within our body, when we're talking about or teaching anatomy, it's usually broken down into organ systems. And there's probably 10 major organ systems that are considered when it comes to the body. And so those are things like the cardiovascular system, the respiratory system, the digestive system, the endocrine system, and all the other systems. So there's 10 of them, but the ones that I am going to cover today that are most applicable to dancers are the skeletal system, the muscular system, and the nervous system. So those are the three that I'm going to cover today. Like I said, there are more than 3 major organ systems in the body, and all of them interact with each other. And so if we truly want to understand how our body works and operates, we do need to understand the other ones as well. But from a dance-specific perspective, those 3 organ systems are the ones we probably care about the most. So our skeletal system is composed of bones, which I think most people probably could have guessed, but it also includes our cartilage, our tendons, and our ligaments. And its major job is to support the structures of the body, to provide support, to provide protection, and most specifically protection of other more vital systems in the body. So if we think about our lungs or our heart or things like that, they're protected by our bony system, by our skeletal system. So in that case, the rib cage, or our brain is protected by our skull. So bones act as a protective system. And our skeletal system also provides attachment sites for other things, most specifically muscles, but also there's a lot of organ attachments to bones as well. And so that's, again, one of the reasons why we can't completely separate any of the systems within the body. They all interact with each other because our organ, like the visceral system that encompasses our organs, attaches to our skeletal system as well. So, like I said, it's made up of bones, cartilage, tendons, and ligaments. We have a lot of bones in our body. There are 206, we'll say, bones in an adult human skeleton. The number's a little bit different for children because we have bones that aren't necessarily fully formed or fully fused yet. So we usually refer to it in terms of mature adult skeleton, but there are 206 bones in our body. I do not necessarily expect dancers to know the names of all 206 of those bones. I don't necessarily need them to be able to name each of the, carpal bones in the wrist or each of the cuneiform bones in the foot or things like that. But I do think dancers should know the names of the major bones in the body. And so again, depending on the age of the dancer, it might be a different number that we would expect them to know. But we do expect dancers to understand the difference between their femur and their tibia, let's say, or to know what their patella is. So our patella is our kneecap, or our scapula, which is our shoulder blade. So those types of bones. So again, I'm not expecting dancers to know all 206 bones in the body, but I do think it is important for dancers to know the names of some of the major bones in the body. Our tendons are a connective tissue that attaches muscles to bones. So they're the connection between the muscles, and we're going to talk about those more in a second when we talk about the muscular system. but it's the attachment that attaches those to our bones. And so I've talked about tendons before on the podcast. I think it was in... I can't remember the episode number off the top of my head, but I've talked about it a couple of times. I think specifically there was a podcast episode where I talked about sprains and strains and itises and the difference between those types of injuries. So we talked a little bit about tendons and that was episode 35. But I also would have talked about tendons and the structure of them a lot in the episode on tendinopathy, and I can't remember that episode number right now, but I'll put it in the show notes for you. So if you're interested in learning more specifically about tendons, you can go back and listen to some of those episodes if you haven't yet. But tendons are the connective tissue that is connecting muscles to bones. Then we have ligaments that are part of the skeletal system as well. And ligaments are connective tissue that attaches one bone to another bone. And so we have ligaments generally at all of the joints in our body that are attaching the different joint surfaces to each other. And again, when I'm talking about understanding anatomy, I am not expecting dance teachers or dancers to know the name of every single ligament in the body. I don't know if I even remember the name of every single ligament in the body, although they generally are just named for the two bones they attach each other to, so you can usually figure it out. But I do think it's really important for dancers and dance teachers to understand the role that ligaments play in attaching a bone to another bone in terms of how that interacts with the joint and protects the joint surfaces and what is happening when we're potentially stretching and things and if we're impacting those ligaments. And so again, there's a certain level of understanding that I think is important for dancers to have. When we are talking about our skeletal system, we also talk about the joints a lot in our body, and I just mentioned them there. So where two bones, or sometimes three, or sometimes more, but where different bones join together, they form what we call joints. And we have lots of different types of joints within our body. So it depends on the shape of the bone and the function of the bone that's forming the joints, what those joint types are like. And so there's lots of different ways that we classify these, but some of the common ones that you've maybe heard of are like a ball and socket joint. So that's one side of the joint looks like a ball and the other side looks like a kind of cup or call it the socket, but basically it's usually sort of dish-shaped or cup-shaped, and the ball fits into that. And so an example of that would be our hip joint is a ball and socket joint, or our shoulder joint is a ball and socket joint. And those joints generally have a big, what we call degree of freedom. They can move a lot. So we can move a ball and socket joint through a large range of motion. So we can basically move our shoulder through, not quite 360 degrees of motion, but you know what I mean? Like we can move it through a lot of range of motion. And same with our hip joint. It doesn't move quite as much as the shoulder, but it's still a large degree. So that would be one classification of a joint. We also have hinge joints in our body. And common examples of hinge joint would be like our elbow joint. It bends and straightens. It looks a little bit like, a hinge on a door or something where it just moves in one direction essentially. Or our knee joint is also a hinge joint. And again, I don't necessarily expect dancers to be able to pick a joint in their body and be able to tell what type of joint that is. But as a dance teacher, if we know that the knee is a hinge joint primarily, and we're trying to explain to students why we want them to be able to utilize the turnout that comes from their hip and not necessarily like over turnout from their feet or screw their feet around, being able to explain that in anatomical terms. So being able to describe that the hip is a ball and socket joint, it has a large degree of movement in it because of that. And so we can rotate our hip laterally or into external rotation to create that rotation. Whereas our knee is a hinge joint. It's supposed to bend and straighten. We don't want to be creating rotation or trying to utilize rotation within our knee joint. So us forcing turnout from our feet is creating torque or rotational stress at the knee joint, which can cause issues and potentially injury later on down the road. So again, I don't expect dancers to know every single joint classification within the body, but I do think as teachers, if we understand most of the major joint classifications, it makes it easier for us to be able to explain some of these concepts that I'm sure you as teachers are just explaining to your students anyway, but in a way that for some students, learning about the anatomy behind it maybe allows them to understand it in their body a little bit better. And a lot of people are like, oh yeah, I can feel that my knee doesn't like it when I try and crank it around or force rotation in it, because that's not really the main movement it's meant to do. It's meant to bend and straighten or flex and extend. In terms of other types of joints, we have saddle joints. A saddle joint is a joint where there's one surface of it that's convex and one surface that's concave, and then the opposite side of the joint fits into that. The best example of that is the base of our thumb is a saddle joint, and again, it gives us a big degree of freedom. We can move our thumb in a lot of different sort of positions. We have, sometimes people call them gliding joints, or some people call them planar joints, but those are joint surfaces that are generally fairly flat and they sort of slide or glide against each other. The facet joints in our spine, where each of the vertebrae attach to each other, is a good example of that. So when we bend forwards or we bend backwards through our back, we have these facet joints that should be able to glide or slide on each other. We have condyloid joints. So they're actually similar to a ball and socket joint, but instead of being round, they're more oval in shape, or condyloid in shape, I guess. And generally not as deep as a ball and socket joint. So an example is our wrist. So we don't have, quite 360 degrees of movement at our wrist, but we do have a large degree of movement through there due to the condyloid nature of that joint. And we can also have pivot joints, and those are exactly what they sound like. One joint pivots on the other one. Example of that would be the top of our neck, where we can rotate our head to look from side to side. So we have pivot joints as well. So again, this might be a bit overwhelming with all these different joint types, but being able to understand why certain areas of our body move how they do really helps us to be able to know how we can move our body, but also know if what we're doing is maybe not realistic or not safe when we understand how parts of our body are operating. So that's our skeletal system. So bones. Oh, I didn't talk about cartilage, did I? I will come back and talk about cartilage in a second. So bones, tendons, ligaments, and also cartilage. So cartilage is essentially connective tissue that protects the surfaces of the bones. So we have different types of cartilage, just depending on what the bone surfaces are like and how they're touching each other or articulating with each other. Sometimes that cartilage can be thicker, like a big meniscus, like in our knee, for instance. And sometimes it's just a smooth covering over the end of a bone. But essentially, cartilage is usually involved in joint surfaces. So where two bones come together, if we don't have cartilage there, then the bones will potentially rub against each other and can cause sort of wear and tear. So there is generally cartilage that is protecting the surfaces of the bones. So that is also part of our skeletal system. Now we are going to move on to the muscular system. So the main role of the muscular system is to provide mobility within the body. So if we remember the skeletal system, its major jobs or its major role was protection and then providing attachment sites and support to the body. Muscular system, its main job is mobility, so movement of some type. Our muscular system is made up of muscles, just like we would think, but we actually have 3 different types of muscles that make up the muscular system. So we have our skeletal muscles, and those are the ones that you're probably familiar with. And when I say the word muscle, that's probably what you're thinking of, like our, hamstring or quadricep or muscles like that. But we also have cardiac muscles. So our heart is a muscle, which is why cardiovascular fitness is so important, because we want to exercise that muscle. And then we have what's called smooth muscle. So we have smooth muscle in our digestive system, for example. And so smooth muscle is muscle that can contract to help with mobility within the body, but not necessarily on a voluntary basis. So we can't think, okay, I'm going to contract my smooth muscles in my intestines right now. Like that's not something that we can consciously control, whereas we can consciously control our skeletal muscles in our body. Muscles are made up of contractile elements, so this makes them different than other types of connective tissue. So we just talked about tendons and ligaments and things like that. Those do not contract the same way muscles does. So muscles are made up of this contractile tissue that allows a muscle to contract or expand depending on what it is trying to do, and that is how mobility is created. So muscles are attached to bones via those tendons we talked about, and as the muscle contracts or it shortens potentially, it's going to cause movement in that bone. And so if it's attached to two different bones, so it's crossing a joint, it's going to move one bone closer to another as a muscle contracts. So that's essentially how our muscles operate, is through this contractile property of muscular tissue. We have more than 600 muscles in our body. So again, I would never expect a dancer or even a dance teacher to know the name of every single muscle in the body. But I do think it is important to know the names of, again, the major muscle groups in the body. And so again, if that's not something that you're super familiar with, going and learning a little bit more of that anatomy can be really, really helpful. When we are learning about muscles and like the information I think that is important for dancers or dance teachers to know is the origin and insertion of muscles. So we want to know where a muscle is starting and we want to know where it is attaching to. Because if we know the origin and the insertion, we can usually figure out the action. And so sometimes people will just memorize the action of muscles. So they'll, pick a muscle. Let's say the quadricep muscle, so the muscle on the front of your leg, its main action is knee extension. And so some people may just memorize that action. And so, okay, they'll just learn that fact. But it's a lot of stuff to memorize if we think that there's over 600 muscles in the body. So I think if we learn and can kind of visualize where the origins and where the insertions of those muscles are, then we can visualize and figure out, okay, if that muscle contracts, so that muscle shortens, what two bones is it bringing closer together? What's the action that's going to happen? And so in the case of the quadricep muscle, it is attaching, there's more than one muscle belly in the quad, but for general purposes, it's attaching from our thigh to our tibia, so from our femur, which is our thigh bone, to our tibia, which is the lower leg bone, along the front of the leg. So if our knee is bent and that muscle shortens and contracts, it's going to bring those 2 points closer together and our knee is going to straighten. And so understanding origin and insertion allows us to then understand the action of a muscle. We also then can figure out if it is a muscle that only crosses one joint in the body, which a lot of our muscles do. They might just cross from like one bone to another bone and they just cross over one joint. So they're only going to have an action on that one joint. But some of our muscles cross two joints in the body. So hamstrings is an example of that, where our hamstrings, the origin of hamstrings comes from our ischial tuberosity, which is our sit bone in our pelvis. And it comes all the way down and it attaches to our lower leg, so to our tibia. And so it's crossing the hip joint and it's crossing the knee joint because it's coming from the pelvis all the way down to below the knee, so to the tibia or fibula. And so the hamstring then has the ability to create movement at the knee joint. And so if you can visualize where that muscle is running and then think of the muscle contracting or shortening, it's going to flex the knee joint. So it has the ability to do that, but it also can act on the hip joint. And so if it's attaching from the pelvis to the knee, and our knee is staying straight especially, if that muscle shortens or contracts from there, it's going to also extend our hip joint. So there are muscles in our body that cross multiple joints. And so again, understanding origin and insertion of these muscles can be really helpful to understand how these muscles are acting on certain joints. And again, there's a lot of muscles. There's more than 600 of them. I don't expect you to know all of them right off the bat, but major muscle groups that we use in dance a lot are gastrocs muscle, our soleus muscle, our hamstrings, our quads, our adductors, our glutes, our lumbar, spine, paraspinal muscles, things like that. I do think it is valuable to understand the action and or origin insertion of those muscles because we use them so much and should understand how they are working. I also think that the more we understand muscular anatomy specifically, we really cut down on some of the, what's the nicest way of putting this, the errors in cueing that we see in dance so often. And I've talked about this before on social media. I can't remember. I know I've talked about it on the podcast as well. But there's lots of cues that get used in dance that are anatomically incorrect. And my biggest pet peeve one is that idea of like lifting your leg from underneath, or don't use your quads to lift your leg, or don't use your hip flexor, or like whatever variation of that cueing a teacher is using is one of my biggest pet peeves. But if we then also think about the anatomy, it is like anatomically, physically impossible. Like it's just wrong. There's no other way of really putting it. It's just wrong. And if we stop and think about, okay, wait a second, we actually like know the anatomy of, I don't know if the quad or the hip flexor or that action of hip flexion. So if we want to lift our leg, we are flexing our hip. What muscles produce that action? Well, it's certainly nothing that's on the underneath side of our leg. So it's not our hamstrings. It's not, I don't know, our glutes, anything else that's on the underneath side of our legs. So if we have a better understanding of specifically muscular anatomy, we will cut down on some of those sort of poor cues that are sometimes used in class that are so frustrating for dancers, because dancers oftentimes have some knowledge of anatomy and then they're trying to figure out how that cue even works. And they're like, but I can't actually physically lift my leg without my, quad or my hip flexor or whatever it is engaging. And they get really frustrated by that. So again, just another case for why understanding the anatomy helps us to use better cueing as we're teaching. All right, so that's our muscular system. And then third one that I'm going to cover is our nervous system. And our nervous system, I maybe actually should have covered first because it truly is the command system of the body. And so our nervous system basically controls everything else within our body. It controls all of our thoughts, our emotions, our movements, like everything in our body is controlled by our nervous system. And it is made up of our brain and our spinal cord, and they make up what's called our central nervous system. And then we have nerves that branch off of those, and that is what we call our peripheral nervous system. So altogether, it's the nervous system, but we have these two main branches, one being the central nervous system and one being the peripheral nervous system. The nervous system operates by sending messages or signals. They're actually like electrical signals or electrical impulses to and from different areas of the body to control things, basically. Like I said, it's the command center. It controls everything in our body. So we have signals that are sent out from our nervous system to different areas of our body. And so that could be to our muscular system, for example. So if we want to bend our elbow, we can consciously think, okay, I want to bend my elbow, and our nervous system is going to send a message to those muscles that's going to say biceps, contract, and the biceps can contract, and we can bend our elbows. We can voluntarily control those things. We also have signals that are sent into the nervous system from other parts of our body. So all of our senses, whether it be sight or sound or touch or any senses, they're constantly gathering sensory information and relaying that information back to our central nervous system to tell our nervous system how things are going, whether things are safe, whether we're feeling, like it's safe or threatening or anything that is going on. So it's continuously getting signals that are going one direction or another, either from the nervous system or into the nervous system. And from that, it then controls everything that we are doing. And so it can control our heart rate and our breathing rate and our digestion, and, literally every function within our body is controlled by our nervous system. And so our nervous system is really important for us to understand, at least again, at a basic level. The nervous system is incredibly complicated, but to understand it at a basic level, because it influences the muscular and skeletal system. And so anything that we want our body to be able to do, and whether that is jump higher or be more flexible or whatever it is we want our body to do, our nervous system has to allow that to happen. And so we need to make sure that we are operating within an environment where the nervous system feels safe enough to allow those types of things to happen. So, like I said, the nervous system is quite complicated, but I did want to touch on it because it is so vital to all other systems that are operating within our body. I've talked lots about the nervous system before on the podcast, and especially when I've talked about mobility and flexibility and things like that. If you're interested, there's a whole series on those topics, but specifically episode 13 was about the nervous system's role in flexibility and mobility. But I've talked about it on other episodes as well. So it is not a new topic around here. And I'm actually going to be talking about it a little bit more in the weeks to come as well. So if you're interested in the nervous system, definitely stay tuned. But I'm going to wrap things up there in terms of this kind of basic dive into anatomy. I hope that has been somewhat helpful. Like I said, I know that listening is maybe not the easiest way to learn about anatomy, but I'm really curious to hear what you think in terms of whether it is helpful to you or whether it's not so much, because if it is something that people are interested in more of, I am happy to do more episodes about a specific anatomy. So, we can really deep dive into, say, like the foot or the hip or the knee or certain regional areas of the body and things like that. But I've kind of shied away from that in the past because I know personally I'm much more of a visual learner when it comes to anatomical things, but curious to hear your thoughts about that. Please reach out. Let me know what you think. If you have any questions or thoughts about today's episode, also feel free to reach out. My contact information is in the show notes. Once again, thank you so much for being here, and I hope you have a great rest of your day.